All right. So yeah, the title of my presentation is with the continuum of care, is how we collaborate treatment and performance. So we want to take these athletes, and I've actually taken and created a guiding principle in my own practice at Sarasota Sports Medicine in Sarasota, and implemented these same types of processes in the office. Hold on a second. Looks like my earpods. Hold on a second. All right, so hopefully everybody can see me. Jump in and let me know if you can. Anyways, we've taken and created in our practice the same type of processes that I'm going to present to you today, and it's based on that, so working with the Orioles and so forth, and the results that we get are pretty phenomenal when we collaborate with other practitioners and other providers in the area, not only in our local area, and orthopedists and surgeons and whatnot, but also our in-office physicians and specialists. So we get some great results, and I think it's because of that coordination. And I know Dr. Winchester is going to be talking about the interdisciplinary processes, and I think it is going to be very, very important. So, of course, we start off in any situation with some sort of an injury assessment, and that is, we're going to do whatever testing that we need, and that is, whatever, as a chiropractor, my analysis, of course, deals with some orthopedic testing, where, if it's a shoulder, we're assessing for rotator cuff, labrum injuries based on the patient symptomatology and presenting complaint. Of course, we analyze posture, because we want to see how the person is weight bearing, to get a full picture of what their whole spine and extremities are doing. Of course, we want to assess range of motion, not just in the affected joint or affected area. We want to get a full picture again of what every joint is doing, and also some dynamic movements as well. And then just some physical assessment, where we want to see, let me get this out of the way, some physical assessment where we want to see, what's happening as far as any other organic problems that the patient or the client is having as well. So, and then there's the diagnostics. So, try to get this out of here. We have our diagnostics. We don't do any diagnostic imaging in our office. We just refer that out. So you'll do X-rays and plain film imaging if necessary, based on how the injury occurred. MRI or MR arthrogram to assess soft tissue injuries, particularly with shoulders, and any CT imaging that we need to do, and then any diagnostic ultrasound. And of course, because we refer these out, we're able to get a radiologist to kind of look over our shoulder and review what we suspect, and then we can review those films and those images as well. And that gives us a clear picture of exactly what's going on with a particular patient, based on the testing that we've done with the orthopedic, posture, range of motion, and physical assessment. And then we have the diagnostics to be able to really zero in and know what we're going to have to do with a particular client. So we always start off, particularly if the patient is in pain, we want to start off with passive treatments. Of course, I'm going to bring up chiropractic because I'm a chiropractor, and that could be, and not every case. So somebody comes in and they have a knee injury or a ACL. I'm not going to do chiropractic on them, but these are the choices that we have. Of course, we can do some physical therapy. We can do some soft tissue work, soft tissue mobilization. Some examples of that could be just regular massage, Graston work, ART, myofascial release. We have in our clinic, we use a vibrocussor, which is a myofascial release tool. Get fantastic results with that. And patients enjoy it too, because it's some of the soft tissue work like the ART and the Graston can be uncomfortable and painful at times. So we, certainly want to avoid, creating any undue pain for the patient. Dry needling is something that is provided by our acupuncturist. In Florida, that an acupuncturist has to do any kind of needling. So I could do it, but I'd have to get my acupuncture license. In other states, I know in Maryland, the Dr. Kalkstein up there, former team chiropractor for the Orioles, he did dry needling, and they could do it under their practice act. So in chiropractic, the different states have different rules and different practice acts. So it's doesn't cross over very well from state to state. So, but needless to say, in our practice, we go ahead and we just have an acupuncturist do the dry needling, along with the vibrocussor and myofascial release. And then prolotherapy, PRP, and stem cell therapy. Those are, regenerative medicine procedures. We do prolotherapy in our office, which is a basic form of regenerative medicine with basically a dextrose solution. And then different modalities that can be employed. Things like ultrasound, laser therapy. We use class 4 laser therapy in our office. Shockwave therapy, and of course STEM. And there's hundreds of different modalities and different things, but the whole purpose of the passive treatment is to reduce the pain level and start some functional healing in the body. So removing whatever is limiting that particular patient. We want to make sure we're stimulating some healing in the tissue, relieving pain with the different modalities, and that allows the patient to go ahead and employ some more corrective type of exercises. Our rule in our practice is we want to, before a patient even starts any exercise rehab, we want to get their pain level down to a level of 2 or 3 out of 10. And sometimes that is different. We have a couple patients that have some severe disc injuries, and we get them to a 5, and they're plateauing, and so we'll move them into some corrective exercises, and that usually is enough to kind of kick them back and improve their situation. So the active therapy, if you didn't do this in the beginning, a functional movement assessment would be ideal at this point. I don't like doing functional movement assessments. It just doesn't clinically make sense in the very beginning, particularly if you're dealing with a rotator cuff injury, an obvious thing that shows up on an MRI or MRA, where somebody has a torn labrum, or they have some other obvious injury. We want to wait until they're reasonably out of pain, and that could be anywhere from 4 to 6 weeks, sometimes sooner. And then we'll take them to transition them as doing a functional movement assessment. And as clinicians, chiropractors, a lot of chiropractors do some functional movement evaluations. Of course, strength and conditioning coaches are familiar with the functional movement assessment. This is a great time when they're transitioning from that passive modalities and passive therapy to active therapy. Corrective exercises. So based on that functional movement assessment, we want to prescribe some corrective exercises for that particular patient. Critically important to really work on stability exercises. I've talked to some strength and conditioning coaches that kind of poo-poo stability exercises, but I think it plays an important role in injury prevention as well as injury correction. And it's my contention, actually, that the vast majority of soft tissue injuries are the result of poor stability of the joints. So if somebody is, for example, if somebody has a knee injury, it's not uncommon to have the individual is quad dominant, not firing their glutes, their lower back and their pelvis is unstable, and that whole kinetic chain is vulnerable to an injury. So even on somebody that is, not even suffering from an injury, it's always a good idea to incorporate some stability type movements, single leg exercises, single leg or arm exercises, bands. Those are really important to really create a situation where we're correcting some of those imbalances and stability weaknesses ahead of time and not waiting for the injury to occur. I wish I could get rid of this thing, and for some reason it's not there. But pitcher's endurance, that is, I learned this with the Orioles. It's if you're not familiar with it, it's a series of band exercises, and I can share that on my email. You guys share my email, and I'll be able to send anybody a copy of any of these. Just, of course, shoulder scaption exercises, and of course, like I mentioned, the glute activation, and then dynamic core stability. Those are kind of tried and true. Great ways to again transition somebody into some active therapy. Even while we're treating their condition, we're able to start that process for the active recovery. And then we finally move on to reconditioning, and that is making sure that we're doing a squat assessment before we start moving the athlete to more heavy exercises, getting away from the bands and the light dumbbells, because moving on to the Olympic lifts, squat, cleans, and snatches, those are excellent full body dynamic movements that again further move that client along in the process of recovering from their injury. And then moving on to I already mentioned all these. And then working on agility and mobility. So, especially if somebody is coming off a knee injury, we want to, of course, we've got the functional movement assessment in the history. We've assessed the squat assessment, and now we're, wanting to move that patient along, make sure that their lateral movement is good, their footwork is good, these are the areas where we're going to be able to see if there's still any weak links in the chain, and be able to address those, prior to that patient, moving on into full playability. Of course, reestablishing the cardio in the endurance, and ensuring that that patient or that client is, ready and raring to go. And from this, we would take that, patient once they, kind of go through this whole process. Usually with the active therapy, that takes anywhere from, usually we'll put somebody on a 6-week program, a couple days a week, in the professional or athletic environment, they might be going more often. And then once they move on through that process, they're into the reconditioning and full into the, into the strength room, working with the strength and conditioning specialists. And in short order, they're going to be ready and cleared to play. So that's all I have. I'll go ahead and turn it back over to Frank, and ready for some Q&A.